Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our Tuesday YouTube Open Clinic with Dr. Chudi. Today we're going to look at prolactin. We're going to look at the impact of high prolactin to your fertility. This condition is called hyperprolactinemia. This condition can actually directly affect your fertility as a woman. Hyperprolactinemia can also occur in men, but it's commonly experienced by men. So please, if you have a few minutes, make yourself comfortable. When you come in, make sure you can hear me clearly. And I'm going to start my presentation. So I'm going to use the first part of my presentation to tell you a little bit about hyperprolactinemia. Then after that, I'm going to take care of your questions. Prolactin is one of the important hormones that will help a woman to become pregnant and nurture the baby. Every woman out there has some level of prolactin in their body, but it has to be within normal range. So when your prolactin level is high or low, then you are classified as having what? Hormone imbalance. Remember that hormone imbalance is a broad spectrum diagnosis that happens when your reproductive hormones are either up or down outside the normal range. So in hyperprolactinemia, for some reasons, the level of your prolactin is high compared to it being within the normal range. And this condition is experienced in non-pregnant women. Pregnant women, high prolactin level is expected. Breastfeeding women, high prolactin level is expected because prolactin will help in producing the milk and also breastfeeding the baby. So it's expected that during pregnancy and during breastfeeding, your level of prolactin will be high, expectedly. Shortly after that, if it begins to be high, then we're a little bit worried. But this evening, we're going to look at what prolactin can actually do to your body in regards to stopping you from becoming pregnant and what you can do actually to get help. So in our community, we don't just talk about the problems. We talk about the problems, then we look at management. And most of our management are natural management. So the condition of having too much prolactin in your body is actually what hyperprolactinemia is all about. So anytime you see hyper, it's high. Anytime you see hypo, it's low. So today we're talking about a condition of high prolactin level. This condition is pretty relatively common in women. Now, by default, when you become pregnant, it's expected to go up. After childbirth, it's expected to go up. Now, when you are not pregnant and you begin to have this, the high level of prolactin can actually disrupt your whole menstrual cycle. Remember that for a woman to become pregnant, a couple of hormones are supposed to come together and lead to the production of the egg through the process of ovulation. Then the sperm will come in and fertilize the egg. When your prolactin level is high, it will affect the function of all the important hormones: estrogen, progesterone, FSH, LH. So you might not likely be able to bleed and predict your ovulation the normal way. So prolactin is anti-fertility. High prolactin is anti-pregnancy. When you are not pregnant and you have this, it can alter a lot of things. Now, in men, high prolactin can also lead to a couple of presentations. Men that have high prolactin can have low libido. High prolactin can also lead to low libido in women. Remember, if you're looking for a baby, you are supposed to be making love 48 hourly. So when your libido is low, you will not be practicing better and your possibility of becoming pregnant will be grossly affected. Now, for some reason, in some women, when they have this high level of prolactin, we can check everything and we won't find exactly what's leading to this. But in that situation, we still need to manage them actively because if we don't correct that, then we'll have a problem. Fortunately, when we discover that your prolactin level is high and we discover the source, we can give you some specific medication. There are a couple of things you can do to help yourself And in some situations, there is a special place in the brain called the pituitary gland. Some women will develop tumor. So tumor is like a growth, but thankfully, this is not a cancerous growth. So some women can develop tumor in the pituitary that will lead to increase in producing prolactin, leading to the same level of hyperprolactinemia. So what are the likely things that can lead to hyperprolactinemia? Number one, I've already mentioned a growth in the pituitary gland, right? That particular type of growth is called prolactinoma. So when you have a growth in that particular gland, they will be producing prolactin frequently. Now, in women, if you are stressed, physical stress, psychological stress, emotional stress can lead to increase in the level of your prolactin. Now, depending on the type of clothing you're wearing, if the clothing you're wearing is really hugging your body so close and it's having a kind of a friction between your body and your nipple, continuous stimulation of a nipple, and very discomforting chest can instigate increase in the level of prolactin. So if you are wearing any clothes around your nipple area, make sure you're very comfortable. Now, some people might also be on some medications to treat depression, to treat psychosis, to treat blood pressure. Some of these medications can also lead to temporal increase in the level of your prolactin. I've already mentioned the prolactinoma. Now, some people can also have underfunctioning thyroid. Remember that your thyroid hormone is the gland in front of your neck. So if your thyroid hormone is not functioning properly, it can degenerate to hyperprolactinemia. Now, some people can also have this problem if they have an eating disorder we call bulimia or anorexia. In anorexia, for some reasons, when you're eating, you eat and you don't actually eat in anorexia. You think you're looking so big and all that, so you begin to starve yourself. On the other end of the spectrum, if you're bulimic, it means when you eat, you vomit everything you're eating because you feel that when you're not vomiting it, you're going to add a lot of body weight. It's actually a mental health problem. So women that have anorexia nervosa can also develop hyperprolactinemia. Now, what happens when your prolactin level is high? Like I mentioned, it's going to affect everything about you in regards to ovulation, in regards to your cycle, in regards to your period. So it will be all over the place. So you will not be able to pinpoint when you are actually able to become pregnant. So it's going to disrupt your whole, cycle. And when that happens, you will have infertility. So hyperprolactinemia is a known cause of infertility. Thankfully, if we identify this, we can manage it and you can get back your life. In men, like I mentioned, it will lead to low sex drive and it will also lead to erectile dysfunction. So it can happen in women, it can happen in men. Now, what are the specific symptoms of hyperprolactinemia? Irregular menstrual cycle. In some women, you won't even have a cycle at all. So you might have amenorrhea. Now you have milky discharge from your nipple when you are not pregnant. If you are pregnant and you notice that milk is coming out from your breast, it's normal, it's expected. But when you're not pregnant, you notice maybe you're playing with your partner or you're trying to make love and you notice that milk is coming out of your breast, that's a red signal. Please ring your doctor immediately. Let's collect your blood sample and make sure that your prolactin level is not high. Thankfully, we can correct this. Now, some women will also notice pain during lovemaking. And some women will also notice a lot of acne, a lot of pimple all over their body. And some women will also notice an increase in facial hair. These are classical presentations that can happen in women. Now, in men, erectile dysfunction, decrease in your body hair, and some men will develop breast. Any man that develops breast like women is called a man that has gynecomastia. That's not expected. Men are not supposed to have breasts like women. But when you have this, then we begin to look inwards to see if we can discover why you're having this. Now, in both men and women, high prolactin level can lead to low bone density. And when you have low bone density, it means you don't have enough calcium. It means your estrogen level is low and your bones can break easily. So low bone density is a presentation of high prolactin both in males and females. Loss of interest in sex. Some people can have visual disturbances and headaches. The reason why some people will have visual disturbances and headache is because when you have this, it's in the brain. So the pituitary gland is in the brain, and the whole area that leads to headache and all that and visual disturbance is just about the area of the pituitary gland. So that's why you might likely have headache or visual disturbance, or you feel like you're feeling dizzy or you're seeing double, which we call diplopia. So these are things that can happen when you have this. It doesn't mean you will have all this. Now, let's talk about management. You see, I've been telling you things that will scare you, right? So I'm sure you'll be wondering, okay, Don, what can I do? They told me I have high prolactin. So what's going to be my, solution? How can I get better? Number one, you have to eat right. Eating disorder is also a predisposing factor to having high level of prolactin. So you have to eat right. So what's eating right? You can still eat all the types of food out there, but in moderate quantity. But predominantly your fruits and vegetables. Make them your friend. Drink your water. Eat your carbohydrate. Eat your protein. Eat your fats. But in the right quantity. So number one natural way of dealing with high prolactin level is what? To eat the right kind of things. Don't become bulimic or anorexic. Eat. You have to eat so your body can function properly. So number one is what? Eating correctly. Now you have to avoid stress. Stress, it's not good. Stress can make it worse. Stress can actually lead to high prolactin level, physical stress, emotional stress, psychological stress. So you have to make it as soon as possible to avoid stress. Now, there are some stressors you can avoid. If you're a Nigerian, definitely you have to be in Lagos. You have to be in the traffic. You have to contend with NEPA. You have to contend with social amenities. They are unavoidable stress. But stressors you can avoid them. When the time for sleep comes, sleep. So remember, you have to eat properly. You have to avoid stress. Now, some people go to the gym and they refuse to go home. You have to avoid high intensity workouts. Workout 30 minutes, moderate workout. Don't go on high intensity workout every day. As a woman, you don't need that. When you do that, you confuse your body. Your body will be in a confused state. So you're not likely going to ovulate. If you pay attention, most women into sports have difficulty becoming pregnant. The only time they might have a better chance becoming pregnant is when they are no longer into active sports. Pay attention to women that play soccer. Pay attention to women that play basketball. Any team sports. If you go to the gym frequently and you go there and engage in high intensity workout, it's going to confuse your body. It's going to lead to hormone imbalance. So avoid high intensity workout. Go to the gym. Keep it moderate. Make it 30 minutes. Go home. Don't live in the gym. When you do this, you are confusing your body. You're likely not going to ovulate. You're likely not going to bleed. And when you don't have this, you have infertility. So I've mentioned how many points? Number one, eat right. Avoid stress. Avoid high intensity workout. Now, the fourth one are things you can do by yourself. When you are wearing any clothes around your chest area as a woman, wear comfortable clothing. Know the size of your breast. Make sure that the size of your bra is in tandem with the size of your breast. Very important. When you don't give enough room in your breast and the nipple is constantly stimulated, they can instigate and they can lead to high level of prolactin. So wear a very loosely but comfortable fitting clothes, especially your bra, your blouse, and all that. Don't wear tight fitting clothing that will make you uncomfortable. When you do that, you're going to increase the frequency, the rubbing effect on the nipple. And when you do this, you are likely going to stimulate production of prolactin, because what happens? One of the things that tells the brain that the baby is ready to breastfeed is the action on the nipple. So it's a kind of a bypass thing. So once the nipple gives a signal to the pituitary gland, they will start producing prolactin. Your baby will start breastfeeding. So you need to be careful. Now, by default, take your prenatal multivitamins. Every singular woman in our community who wants to become pregnant is advised to start taking their prenatal multivitamin. Once you are making love without protection, start taking your prenatal multivitamins. Remember, 400 to 600 microgram of what? Folic acid. Start taking it before, then 3 months into your pregnancy. Now, when you're taking the prenatal multivitamins, pay attention to vitamin B6 and your vitamin E. You don't need to take extra. They are already contained in that prenatal multivitamin. So you don't necessarily need to go overboard. Very, very important. Now, in some women, we might not find the cause of this high prolactin. They are called idiopathic hyperprolactin level. In that situation, the hyperprolactin will resolve over time. So it's not all high prolactin level that is coming from prolactinoma, that is coming from all the stuff I mentioned. In some women, we won't find out why they are having this. And in those women, it will resolve by themselves. Okay, so just know that if you have any problems in this regards, go to your doctor. Your doctor will be in the best position to tell you the right kind of things to do. Okay, now when we have done all this and we are still having this problem, then that's about the time you go to your doctor, your gynecologist. There are specific drugs we can use to treat appropriately high level of your prolactin if it's coming from areas we can control. Now, some women can have tumor, big tumor in their pituitary gland. What's going to happen? We have to go and remove it because that's the source of the high level of prolactin. So your management of hyperprolactinemia is dependent on the cause of the hyperprolactinemia. If the cause of your hyperprolactinemia is coming from the drugs you're taking for your depression, from your psychosis, then we need to look for alternatives. If it's coming from the growth in your pituitary gland, then we need to go and remove it. If it's from hormonal, imbalance, then we give you some drugs. So the popular drugs out there are bromocriptine, also called Pallodel. Bromocriptine or Pallodel. But please, I'm just mentioning it for mentioning's sake. Do not take any drug that your doctor did not recommend and monitor. But the popular drug of choice for treating hyperprolactinemia is what? Bromocriptine. Some other women might be given what we call cabergoline. These are the two important popular drugs we can use to make sure that the level of your prolactin level is what? Within normal range. So if we succeed in bringing the level of prolactin within normal range, then we are increasing your possibility of becoming pregnant, because when we do that, you can ovulate, you can have your regular period, then you can have normal libido, then you can make love and become pregnant naturally. Okay? So that's my presentation this evening. I'm going to open the clinic and give you an opportunity to ask your questions. So I can see Tosi, thank you and welcome. Please ask your questions in real time. I think we have about 15 minutes to interact, and we will have fun. I think there is one person that is trying to spam the group. Please ignore the naked HD, whatever person that is trying to scam the video. But please ask your questions, I'll provide you feedbacks. Okay? If you have questions, please ask. Very important. This is a very, very treatable part of your infertility. So women that have this, until we address this, you might not be able to become pregnant. But it's one of the easiest cause of infertility, because once we discover the problem, we can manage it. Thank you, Kenneth, and welcome my COO. Please ask questions. Let's interact in the next about 10 minutes, and we can go and get ready. Remember to join me tomorrow for my midweek community health clinic. And remember to join me on Friday, then join me on Saturday, then join me on Sunday. Every day is a good day in our community. If today is the first day of attending, please remember to subscribe, share, and tell your friends about SGHS. Okay? But right now, ask your questions so I can provide you feedbacks. Do you have any questions? Okay, let's go. What lifestyle changes can one make to aid resolution of PCOS while taking medications for it? Now, can I mention another important factor in the fertility of a woman? So PCOS stands for Polycystic Ovarian Syndrome. In Polycystic Ovarian Syndrome, for some reason, I think I have my teaching model somewhere here. Okay, yeah. I have my teaching model here so I can explain it better. So in Polycystic Ovarian Syndrome, what happens? For some reasons, when we get to the ovaries, you can see the ovaries. When we have a cross-section of the ovaries, we'll have multiple fluid-containing substance inside the ovaries. Normally, your ovaries are not supposed to have polycystic. Your ovaries are only supposed to contain the follicles, which contains the egg, which will release the egg every month. But when we come to this place, you have multiple of this. When this happens, it leads to hormone imbalance. So the major problem in polycystic ovarian syndrome is lack of ovulation because the hormones are no longer performing their role. When this happens, the hormones that a woman is supposed to have will not be adequate. They will start converting it to male hormones, which we call androgens, and women will start presenting like men. So that's why in women that have polycystic ovarian syndrome, they develop facial hairs, they add a lot of body weight. They look pretty much like men because their hormones are no longer in the female range. Their hormones are now in the male range. Now, how can you handle this? Beside the drugs I'm going to give you, you have to work on your body weight. So you have to eat correctly. You have to exercise, avoid your alcohol, don't smoke, drink your water. So the lifestyle modification you can actually use to make sure you have a good outcome if you have polycystic ovarian syndrome is what? Exercise. You have to exercise for at least 30 days. Then you watch what you eat. We become what we eat. So if you have any weight-related issues, you have to watch what enters your mouth. You have to eat, but you have to eat the right kind of things. Then when you've eaten the right kind of things, you have to stay active. So if you can exercise, eat properly, avoid stress, sleep, avoid alcohol, avoid your soda, then you are going in the right direction. So that when we give you a couple of treatments for the PCOS, sometimes we might give you Clomid, we can give you metformin, because one of the problems in this particular issue is problem with your insulin, which handles your blood sugar. So when your insulin level is not within the normal range, you might likely present like someone that has diabetes. So that's what happens. So lifestyle modification, exercise, eat good food, avoid stress, sleep, don't smoke, don't drink, coke, and all that soda and alcohol, okay? Very good question. I love that. Please remember when you come in, we're talking about the management of hyperprolactinemia, which is increase in the level of your prolactin. And we made ourselves to understand that high level of prolactin can lead to infertility. So if your prolactin level is very high, as I'm talking to you right now, and you want to be a mother, then you need to have conversation with your gynecologist. Because if we don't bring it down, then the possibility of you becoming pregnant is limited. Okay? All right. Keep asking your questions, please. Keep asking questions. We have about 8 minutes. So let's interact. Understand this topic very well. It's a very, very common problem for women. Majority of women would have had this. Majority of women are taking a couple of medications as I'm talking about it right now. So if you have this, please learn well about it. Okay, high prolactin seems common. Correct. Correct. Are there environmental factors that can lead to this? So one of the things we have to remember is this. When we talk about environment is not just the physical environment. Your environment can be your relationship. Your environment can be your friends. Your environment can be your work. Your environment can be your home. So any of these environments which leads to increase in your stress level can alter your hormones. So yes, it's very common among women for some reasons. So if you're someone that has a lot of stressors in your life, then likelihood you have to work on your stress level is very high. So if you're a woman that doesn't sleep, you don't eat good food, you're not happy, you don't exercise, then the likelihood you might have a risk factor for developing this is very high. Okay? So yes, you have to watch your physical environment. You have to keep good friends. You have to have good family. You have to have a good working place. If your home is toxic, if your environment is toxic, if your home environment is toxic, if your relationship is toxic, if your work relationship is toxic, the possibility you're not going to succeed in becoming a mother is very high. Thankfully, they are temporal problems. Okay, so that's what you need to do. All right, if you have more questions, please ask. Ask your questions. I'll provide you feedbacks. Okay. All right. Do we have any other questions, please? If not, we can wrap up at 25. I normally love wrapping up at 30 minutes. But if we don't have any other question, we can wrap up at 25. If you're joining, we're talking about the management of hyperprolactinemia. Hyperprolactinemia simply means your level of prolactin is high, higher than the normal range. And it's something we need to address, especially if you're not pregnant. Okay? All right. Do we have questions, please? Can this condition be genetic? Well, the jury are not back yet on the genetic component. But here's what we know. Most things that happen in the infertility realm Some, to an extent, tends to be familial. So most of the things your mother or your sisters might have might be familial, but there is no strong concrete evidence to show the familial tendency. So we haven't ruled it in, we haven't ruled it out. It's possible. So it's one of those situations we can say it's likely, but we are not definite for sure. There are certain things we know for sure that when you have it, if your parents have it, you can have them. Diabetes, hypertension, cancer, or any other reproductive problems. So if your mom had cancer right now, then the possibility you might have cancer is very high. So we need to keep an eye on you. If your mom has hypertension or diabetes, especially sons tend to copy their mothers and daughters tend to copy their fathers. So if you're a woman, if your daddy is diabetic, you need to be careful because the possibility you're going to be diabetic is very high. If you're a young man, if your mom is hypertensive, the possibility you're going to be hypertensive is very high. Guess what? We can inherit all these things, but we can flip them. So you might inherit obesity gene from your family, from your mom, from your dad, but your lifestyle can tame that obesity. If you do the right things, you won't come down with obesity. So the most important thing in life is what you decide to do in this life. Okay? Correct. If you're coming in, remember we're talking about prolactin. We're talking about the high level of prolactin in your body, what you need to know. And I talked about eating right. So you need to eat right. You need to eat the right kind of food. You need to eat your vegetables, eat your fruits, drink your water, take your protein. Then avoid stress. All forms of avoidable stress, avoid them. Mind what you wear. Give your breast, give your nipples some room to play along. The more closer you wear things that will hug your body, the more the likelihood you're going to predispose yourself to developing this. So these are the few things you can do by yourself to get relief from this. Okay, your doctor requested for an MRI scan to know why. Do you know why? Because your doctor might be suspecting prolactinoma. So the MRI scan is to look at your pituitary, a special gland in the brain which produces a lot of hormones. So the reason why we are looking at the MRI scan is to see if you have prolactinoma, especially if you present with frequent headaches, blurred vision, and disorientation. It's possible that the reason why your own prolactin level is high is because of that tumor. Thankfully, it's not a cancerous tumor. It's a benign tumor. So what do? We go for surgical correction. Okay? So that's why they are asking for the MRI. So if you're in a facility that have access to MRI, we might require MRI to make sure you don't have prolactinoma. Okay? I love that question. Please ask your questions. Let's wrap up. We have 2 more minutes. You have 2 more minutes to ask your questions. If you haven't seen the previous videos, make our time, check our channel. There are thousands of videos that will help you to know your body better. If you happen to be in Facebook, check us out, our group, our page, my personal timeline, then our community page. If you're in TikTok, guess what? I'm there. If you're in Instagram, I'm there. I'm currently in YouTube, I'm in Twitter. So we are virtually everywhere. Why are we everywhere? Because we want to reach out to as many people as possible. We believe that the more we reach out to people, the more people are aware and the more people are taking opportunities and taking chances to achieve what they want to achieve in life. So if your biggest dream is to be a mother and you discover what the problem is, seeking solution is the next thing. But when you don't know where the problem is coming from, that's why the problem will be complex. So assuming you've been having problems with becoming pregnant, then we suddenly discover that it's your prolactin, we have solved the problem. Because what are we going to do? We tame the prolactin and you become pregnant. So getting the right diagnosis is very important. Okay? Thank you for coming. At this juncture, if I don't have any other question, I'm going to take my leave. Thank you. And remember, today is a special day. If you're a woman, you rock. I'm team women. I believe in equality. I believe in justice. I believe in breaking the bias. So if you're out there, if you're part of the people that don't really give women enough acknowledgement, enough respect, enough reward, enough regards, then it's time we begin the conversation to break the bias, to break the barrier, to stop the institutionalized stigmatization against women. We have to give women a chance. And on this day of International Women's Celebration, I love my women. Please, you rock. Keep on keeping on. Enjoy the rest of your weekend. And I'll see you guys again on when? Saturday. So the next clinic will be when? Saturday. Thank you and enjoy your evening, and bye-bye for now.